Among those who have come to Haiti since the earthquake is Tamar Hahn, the Regional Communications Officer for Unicef in Latin America and the Caribbean. Unicef Radio spoke with Hahn on the phone from Port-au-Prince, Haiti.
Well, on the ground here today in Port-au-Prince, the situation continues to be very, very difficult for all the victims of the earthquake. A lot of people are leaving the city. You can see them walking with bundles on their head and getting into cars, and there's a lot less traffic in the city overall. It's starting to look like a ghost town in some parts. Everybody here has stopped sleeping at home, and they sleep in very crowded conditions in squares or directly on the street. They actually block the street so that the cars can't come in, and they just sleep there. Of course, there's no water, there is no sanitation. They use the sidewalks for their bodily needs, and it's extremely crowded, very noisy, and when it gets dark here, there's no electricity, so it's completely dark, and they just have a few candles. Other than that, I can report that UNICEF has been distributing water in 17 points across the city. We are also working on creating some shelters for children who have become separated from their parents, either because they lost them during the earthquake, meaning they're dead, or because they became separated from them in the chaos that came after it. So we're working on that. We're trying to put together a place where they will be safe, they will be taken care of, they will have food, they will have medical assistance if they require it, they will have psychosocial support, which all of them need very, very badly. And when they're there and they're safe, we can begin with the family tracing process and make sure that we reunite them with either their parents or other members of their families, or look for alternative solutions for them.
Are the schools playing a role at any point, or teachers at all playing a role in the psychosocial support or any kind of activities to help kids deal with some of the trauma that they've seen in the last few days?
Well, I hope that they will, and I think that that's part of the plan. But also right now, 5 days after the earthquake, these shelters are not set up yet. It will take some time. It takes some time because you have to secure an area, you have to furnish it with whatever it is that you need to make it appropriate for the children. You need to have staff under contract to come and work there, identify the staff. And in Haiti today, doing all of that is incredibly difficult. So we're working on it very hard, but it will take a little bit of time.
Can you tell us anything about the hospitals there? I know a lot of them were impacted by the earthquake.
Yes, there are very few hospitals that can provide the treatment that is needed by some of the patients. So a lot of them have to be airlifted somewhere else, and a lot of them, unfortunately, die because they don't receive the care they need. Right here, where we are at the Minufta base, there is sort of a field hospital, which is full to capacity, and basically it's a triage center. That's all they can do. They have just started operating an operation room, and all they do there is basically amputations. And they have little morphine. They have very little of everything. Very little food for the patient and for the doctors. Very little water. There's no sanitation whatsoever. So the situation in the hospitals is very, very difficult.
Are there any stories that you can share with us of people that you met or talked to, or things you saw or witnessed in the past few days to help give listeners an idea of what it's like there right now?
I also saw people in these camps, it's so crowded. And, there's nothing there, there's no water, but they seem to be calm, and they seem to be sort of getting organized amongst themselves and cooking, and a little bit of communal cooking going on with very basic food supplies. But they just seem to be very calm and taking this in stride in a way that I find admirable, because the circumstances are frankly horrific. And for them to just be there and waiting patiently and answering questions and seeing all of these aid workers coming and going and bringing things and asking them things, and they just do it, and they just take care of themselves, and they take care of the people besides them. Even at the hospital, I've seen a woman take care of a little child, a 2-year-old, who is there on her own. And so that's, that gives you a lot of hope, and that also shows you that they're not just victims, they're people who are extremely resilient.